Golfer elbow, affect FCR and pronatilis, medial epicondylitis, treatment counter force brace, open debridement of pronatilis and FCR, risk is medial antebrachial cutaneous nerve injury. Lateral epicondylitis, tennis elbow, overuse injury, eccentric overload, may involve micro tears, feel tenderness at ASCRB, extensor carparidalis brevis, some millimeter distal to the epicondyle, test by Cousin test, resisted wrist extension with elbow in extension and forearm pronated. Cousin test positive, test for ECRB. You can also test by middle finger extension called Maudsley test, ESRB insert on third EMS metacarpal. Resistor applied just distal to the PIP of the middle finger. Pain at lateral epicondyle. Differential diagnosis, retrocapitellar degeneration, radial tunnel syndrome. Radial tunnel syndrome pain is 4 cm distal to the epicondyle. X-ray may show calcification of extensor tendons. MRI rarely advised. Ultrasound show thickening of ECRB. Histology will show the fibroblast hypertrophy, disorganized collagen, and vascular hyperplasia. Treatment, non-operative, counterforce brace, straps, eccentric physiotherapy. Number 2, steroid injections if less than 12 months. Schmidt et al. 2002 shows that early injection, that is within 6 weeks, is better than physiotherapy, but later on, 26 to 52 weeks old, physiotherapy is better. PRP injection is a possibility. There is strong evidence that PRP injections are not efficacious as per BJSM 2014. Operative natural procedure, ECRB release, arthroscopic possible. Complication can be injury to lateral and collateral ligament and injury to the radial nerve.